Good morning and welcome, Jennifer.
Hey, good morning.
Thank you for joining us this morning.
Oh, I'm glad to do it.
We're amateur hour here, so bear with us as we fumble and bumble. We are recording this and we will post it on the Little Rock Neighborhoods YouTube channel. So we have a chance to get the message of today's meeting out to absent friends.
Great.
And so far we are the only two here, so we're collecting. I'm not particularly skilled in the recognition of Zoom hands up and thumbs up. So I'm just going to try and work through it all and recognize folks' questions.
Yeah.
We
well, and I don't know, do you follow the chat also? People will ask questions in that.
They do. Let me see. I've got participants up and yes, I now have chat up. Good thing. Thank you.
Okay.
We've got chat. We've got record. We've got participants all live on the screen. I did find the health department resources page and link, and I sent that out the first of the week when we announced that you were come to visit with us today. So people have a chance to see what you do have and maybe what still is a question. I have a couple myself. Let's see, we have admit all. I think I want to admit all. Yes.
Just what happened?
Good morning. Welcome, Paul.
Coming on here.
Good morning and welcome all, and please bear with our amateur lack of skill here, but we will persevere to get questions rendered and answered, and we will record this and post it on YouTube. Let's see. I need to make Luke a co-host, I think. Is that right, Luke? Make you a co-host?
Yes, if you want me to help out at all, I think you could. My computer's having a little bit of a trouble getting started, so I'm on my phone right now, but I'll be switching over to that in a few minutes.
How do I do that? Let's see. I've got you up in the participants. More, make a host.
Yep. Host, and if you
so let's join. I have
a computer here for just do it.
Let's
waiting for
you might want to just speak. Well, our time is valuable. We will hope that others join us. We certainly will not lack for questions with the group that we have with us. So I'm going to say, let's get started with this meeting of the Coalition of Little Rock Neighborhoods, November the 21st. We are very, very gratified that the state's chief epidemiologist, Dr. Jennifer Dillaha, is our speaker today and will answer our questions about defending against the double whammy of COVID-19 and the flu season this winter, and anything else that might come up in people's concerns. We have introduced folks. I'll try and identify the others as they come in from various neighborhoods. I would like to start off with the question of the combination with the flu season and COVID-19. My impression is that at this point, there's more instant threat from touching and doorknobs from the flu, while the transmission through the mouth and the droplets in the air remains the big threat from both COVID and the flu. So we really ought to be polishing those doorknobs as well as washing those hands. But Jennifer, tell me what we should be thinking.
Sure. So flu and COVID-19 are definitely different diseases. COVID-19 can kill people by a variety of ways. One is the pneumonia that it causes, but it can also cause extensive blood clotting. So people can die from the blood clots, depending on where they form or whether the clot moves to the lungs and kills you that way. It can infect various organs. It's known to infect the heart and cause heart failure. And one of the most concerning effects is that it messes with your body's messaging system. It's called the bradykinin messaging system, and causes such dysregulation that the body cannot regulate itself. And it causes a bradykinin storm, they call it. It's clearly more deadly than the flu, at least 10 times as deadly as the flu. The flu causes pneumonia also, but by a different mechanism, and it will destroy the cells that line the bronchial tree, the breathing tubes that go to our lungs, and allow, as a result, entry of bacteria so that you can get the flu, and then on top of that, a bacterial pneumonia. And that can also be very deadly. Flu can also infect other organs, including the heart, and cause heart failure, but that is much less common than with COVID-19. So both of them are really just nasty diseases if you happen to be one of the people who gets one of the more severe forms. The people who are more likely to get a severe form of either COVID-19 or flu are older adults. As we age, our immune system wanes and we're less able to defend against new viruses that our bodies haven't seen before. Also, people who have chronic conditions, heart disease, lung disease, or if they're immunocompromised or we have a weakened immune system, then they will be less likely to withstand the infection because they can't fight it as well. It taxes your systems. They can both provoke a heart attack. So the idea of preventing these, even for people who have mild disease and can pass it on, is really a very important strategy. Both of them are spread by what we call respiratory droplets as well as aerosols. So primarily in both cases, it's the respiratory droplets. These are the droplets that people give off when they cough or sneeze. But they can also give off smaller droplets that don't fall to the ground like the ones when we cough or sneeze. But the aerosol droplets are generated when we talk, when we laugh or speak loudly or yell or cheer at a sports game, or like when we sing at church. Those are especially singing, are very good ways of generating aerosols. And these are droplets that are small enough that they linger in the air. And over time, in a setting where there's poor ventilation, they can accumulate in the air. This is a very important concern for both illnesses, but especially for COVID-19. So we are recommending to people to prevent spread. Everybody should operate when they're out in public or with people who are not from their household as if they could infect someone. We know that probably about 40% of the people who have COVID-19 are not symptomatic or just don't develop symptoms for the whole course of their disease. They're what we call asymptomatic. And some people just haven't developed symptoms yet. They don't know they're infected, and the symptoms don't start until your body's immune system has seen that virus long enough it can kick in. It has time to rev itself up to kick in to fight the virus. That's when the symptoms start, but people are very infectious the couple of days before those symptoms start. So we strongly encourage people when they're out in public to keep a 6-foot distance from other people and to wear a face mask or cloth face coverings. The main purpose of the face coverings is to prevent the wearer from spreading COVID-19. It can offer some protection from getting it, but it's the main benefit is keeping people from spreading it. And it actually can help prevent the spread of the flu. We've not done this in our country before. Other countries often wear face masks during flu season. So it is our hope that with the measures that we're doing along these lines to prevent COVID-19, they will go a long way toward preventing the spread of flu as well. We saw in the spring when many of these measures went into place around the country, we saw a very rapid drop off of flu cases. So I think that this really will have a good effect in preventing the spread of flu. Of course, with flu, we have other measures we can take to lessen the severity of disease or even prevent it. So we have antiviral medications that are specific for the flu. So if someone is diagnosed with the flu, then they have these medications that they can use outpatient to prevent them from progressing to severe disease. We also have a vaccine for flu. That's actually it's not the most effective vaccine we have out there, but it's effective enough to really make a difference in people with severe flu and hospitalization rates. On a good year, a flu vaccine is about 50% effective. And by that, we mean it's 50%, it keeps half of the people who get the flu vaccine from getting ill enough with the flu that they need to go to the doctor. It does a much better job of keeping people out of the hospital and keeping people from dying. One of the most common misconceptions about the flu vaccine is people say, well, I got the flu from the flu vaccine. And it is absolutely medically impossible to get the flu from the flu vaccine. They don't even have a complete virus in them. So the flu shots cannot give you the flu, but it's still possible to get the vaccine and get the flu. It takes a couple of weeks to develop the desired immunity from the vaccine. People can get infected in that interim, get the flu. And sometimes the vaccine just doesn't match what is circulating as well. So you can get the flu that way. And then some people, such as older adults, don't mount as robust an immune response to the vaccine, but the vaccine is enough to keep them out of the hospital and keep them alive. So this year we are strongly encouraging everyone, even if they've never had a flu vaccine before, to get one. Our hospitals are approaching the point where they will not be able to handle all of the patients that they're getting. Not just COVID-19 patients, but other patients that need urgent acute care. And so as many people as can get the flu vaccine, the more hospitalizations we will be able to prevent in Arkansas. You may have heard in the news about the potential for an upcoming COVID-19 vaccine. There are several vaccines being developed in Arkansas and not in Arkansas, in the US, but we may have some of those initial vaccines available to us in Arkansas as early as next month. The doses available will not be sufficient to vaccinate everyone. So we are making plans to provide the vaccine to the people at highest risk for infection. That would be healthcare workers and those people at highest risk for severe disease. And those would be older adults, especially those people who live in long-term care. And then other people who are essential workers that if they were to get COVID-19, it would hamper our functioning as a society. So it's not likely that we'll have enough vaccine in Arkansas until probably about April or so. But we're working hard to get ready so that whenever the vaccine is shipped to us, then we know what our plan is and how the vaccine doses will be allocated. So I'm going to stop now and take more questions.
A question personal and a question general. All this hand washing has led me to develop chilblain openings in my thumbs, a hazard of my life. But I'm not seeing a recommended hand lotion that is safe and germ-free or what have you. So what's the health recommendation on after we've washed our hands to get the germs off, we put on the lotion to keep our hands from cracking to pieces?
Yeah, I struggle with that every year. It's a problem for healthcare providers. So a couple of things. One is if you get them like on your thumb and the split opens up every time you use your thumb because you put pressure on it, then what I recommend is you get some petroleum jelly and put on your thumb and then cover it with plastic, or not plastic, but some impermeable covering. I used to use just a corner of a sandwich baggie, but now I just cut the thumb off of a vinyl glove and put that on my thumb overnight, and it promotes softening and healing. Any good hand lotion would be fine, as long as I like the Eucerin advanced care lotions. They work the best for me, but any of them should be manufactured to the degree that it would not promote infection.
In general, what can we do as neighborhood activists to support our healthcare community in this time of crisis, aside from keeping out of the hospital?
Yeah. Well, if you have friends who are healthcare workers, they're working long hours likely, and I would encourage you to let them know you're thinking of them. And if you have time to assist them with errands or other things, that would make a big difference. I'm very fortunate in that my brother lives in my household and he's taken over all the grocery shopping, and he has been here when, workmen have to come to the house, or he takes our pets to the vet. And so those kinds of things, because when you're working hard like that, you don't have much leisure time. And if you're using your leisure time to take care of all the things, you really don't get downtime. And doing things to help the healthcare workers that
Thanks for joining me, and thanks for working your team. I wanted to ask about COVID transmission locations or places where the contact tracing shows there's the greatest spread in certain areas. I hear discussion of, shutting things down and just very generally, but are there 2 or 3 specific places that y'all find there's heavier spread, or is it more activities, or if that makes sense?
Mm-hmm. It does. So we try to look at those, but we are really stretched in terms of our team to be able to look for them. So we do see clusters at social events that, like weddings, where people decide they're going to get together and have a nice wedding and not wear their mask, not social distance, not at a wedding. And then lo and behold, many people come up with it. Unfortunately, we have seen a lot of spread through churches. And there are some churches that have made decisions because the mandate doesn't apply to them, that they don't really need to wear masks. And we've seen spread and deaths among congregants and churches. And the interesting thing is the congregations that follow the guidelines we put out for churches, we don't see spread at all. So there's a very big dichotomy. We've had to change our guidance for churches because what would happen is that people would sit down in their groups, like family groups, more than 6 feet from each other, but they would sing, and singing aerosolizes things so well that the 6-foot rule just doesn't apply. It goes beyond that. So we've changed our guidance for people coming in to keep their mask on at all time. Some churches have chosen not to have choirs, but have maybe a soloist or a cantor, and that those churches have not seen spread. So it's, and I'm not really picking on churches in the sense that they, it is possible to go and worship safely, and I want people to go and worship safely. But any social setting that's analogous, where you have people coming together and it's indoors, ventilation has a lot to do with how quickly the aerosols that are dispersed. So in the wintertime, especially when you're indoors, those kinds of settings are the ones where you'll get the accumulation of the aerosols and really good spread that way. We see it also in sports teams, and it's not necessarily during practice, but it could be the games or the parties they have after the game is over. So we see spread not so much in the schools, but the out of school activities that young people engage in. And we have had a lot of difficulty in university settings where young people go to bars and gather off campus, thinking that, if no one knows, if people don't know they're partying, they won't find out. But if they are partying, then of course we will find out, because there will be cases, right? So it's those kinds of social settings. I'm really worried about Thanksgiving. Travel. I would encourage people not to travel this year. There's so much spread around the US and in Arkansas, and to have Thanksgiving with their households. And I know this is a hardship. I haven't seen my younger sons since the beginning of August. They went to visit their dad in Idaho, and I guess it's the mother bear in me. I'm telling them, do not come home right now. Where they are, there's so much less spread. And I may not see them till next summer, but I would much rather do that than have them come home and be one of the young people who ends up in the hospital, although it's rare, or has heart failure as a result of this illness. And I would rather them not bring it home to me. So does that give you a general idea?
Yes, it's very, very helpful. It sounds like it's the activities really more so than perhaps the locations, I guess you'd say. I mean, except for the one you
Yes.
mentioned, it's more
Yes.
people together in large groups, close settings with no masks, I guess.
Yeah. And, once it gets into a community, if people are used to it not being in their community, it will get in and spread among so many people before they ever know it.
Thank you very much.
Sure. Yes.
And so that takes you to all the ways we might, one, survive extensive resources when you go there. And early with your sons, one of the things such as basically for best use, there are that's a tool. We need more tools in our kit.
Yeah, but just an old-fashioned phone call or a letter works really well too. I have just been so touched by the people who've written me cards and letters just to say they're thinking of me and rooting for me. And, if it means that much to me, think, other people, if they get a handwritten card or letter, oh my gosh, you keep that and you look at it again and again. And, that's a good way to brighten someone's day and it makes a difference. But just, I talk on the phone to my sister and her family every so often. And the last time I did it, we Skyped it, and it was like a whole new world. Why hadn't we been doing this before? So I do encourage people to stay connected that way. There's something about being able to see someone even on a screen that's different than, just hearing the voice.
Amen, sister. Who else has a question?
I do. This is Luke. So as far as kind of working with our neighbors, and that's what we really do, is we try to relay this type of information and try to help our neighbors. I know that even here in Hillcrest, people are stir crazy. They are wanting to have more outdoor dining. They're wanting to have more social interaction. They're wanting to try to, ramp back up some of their community outings together. And it's hard for, I think, sometimes us who help with our associations to balance that, to be able to kind of to encourage people to get out of their house and try to maintain some level of sanity, but also have to sometimes fight against people wanting to get together. Has there been any studies, or like when we have the like in Argenta or downtown, where we have these communal social settings where people can eat and come together? Are we doing enough to mitigate the risk when we do those things within our neighborhoods?
I guess it just depends on how closely the restaurant follows the health department guidelines. They're not really well enforced, and many restaurant owners or workers are reluctant to ask people to put their face masks back on or to social distance. And I think those are some of the hardships. I think people, if they are in a situation out socially where people aren't distancing or wearing face masks, they should just turn around and walk away. I don't know really how to get people to do the right thing in that case. I think, the later you go in the evening, the less, at least anecdotally, what we know is the less likely people are to social distance and wear face masks. So going earlier than later is probably a better strategy. But you are right. People are stir crazy, and they're allowing that emotion that goes with it to drive their behavior that is not going to be good for themselves or other people.
And one other quick question. I know that a lot of the people I've talked to are concerned about the long-term effects of this, because we've seen a lot of people that have had neurological issues, that have had issues with their heart. I mean, these are things that months and months later, they're still struggling with. So, can you give us maybe a snapshot of what are some of the biggest long-term effects that we're seeing from coronavirus at this point? I mean, we still don't know fully how this is affecting people.
Yeah, and because people don't know, they think that it's no big deal. So there are people that have had long-term chronic fatigue, and they cannot return back to, at least at this point in time, to their previous functioning. People have lasting heart damage, lasting lung damage. And there's a lot about why all this is happening that we don't know yet. I think there's more information coming out, but many people are just devastated by this illness, but they survived it. If more people knew about it, they might make different choices about how they spend their time and the activities that they do to that would potentially put other people at risk. So the Washington Post actually has had a series, and I haven't looked at it lately, of articles about people who have either kind of discounted the severity of the illness or the problem and then ended up with it, or as a result of their activities, their family members were affected or they have developed severe disease. I think helping people become aware of those stories. So if y'all have links and can identify those things so that on your websites, you could say, here, to understand the illness, you can go to these links. That would be probably a useful thing to do. It's not really something the health department can link to certain other media, but you all could on your websites if your neighborhood associations have them.
It's almost like going to war. You always hear about the casualties, but you don't hear about the 10 times fold of the people who were injured. And so that those long-term
Exactly.
effects. Anyway, thank you.
Yeah.
I appreciate it.
Yeah.
I'm putting together a thing. Let me ask you to confirm or correct the notion. So what we might do as neighborhood groups is to arrange with some facility, let's call it the neighborhood church, that's willing to let us into their big meeting room, classroom on a regular basis, where we could be carefully masked and distanced, and maybe create a thank you writing session, postcards to the ICU folks at the hospitals of Little Rock, to the health department folks. We could create an address list, more or less named, that would give those folks that are stir crazy, Luke, a way to come out and distantly socialize with their neighbors and do what neighborhood associations are so good at doing, which is enable folks to come together and assist those who would benefit from their assistance, or less fortunate than themselves,
Yep.
or in this case, would benefit from the thank yous that we might send. And this could obviously be chosen by the people. You'd do a little organizing on the postcards and running the stamp fund and, keeping the address list handy. And it's a variety of what churches do when they add you to the prayer list. But it's something that civic groups could do that would get them out of the house, get them in the room with neighbors, safely distant, and doing something they both feel really good about doing. And it takes as much or as little time as you want to give it. So is that a good way to go, Jennifer?
That's as good as way as any. I think one of the other things y'all could consider, well, that to me that I worry about are the people who live by themselves in your neighborhoods and need some kind of interaction or contact. So there's ways of addressing that too that you probably could come up with. Yeah.
Yes, Brad.
I had one other question. I've been reading that even when the vaccine becomes available, that there will be a large segment of the population that, for whatever reason, won't feel comfortable taking the vaccine. Is there a role or that we could be playing as citizens to message out that this is something that you should be doing, or have y'all given thought to that?
It's a difficult problem to solve because part of the reluctance appears to be because the vaccine is being, the whole process has been compressed. People think that means that they're cutting corners on the safety and efficacy studies. And that is absolutely not the case. And so let me just say a little bit so y'all will know. So usually when we're looking for a vaccine, in the past, it's taken us years to find a good candidate to work as a vaccine. What do you target and so forth. But in the last 10 to 20 years, the vaccination or vaccine technology has gotten to be so good that they were ready to go with a vaccine once they know the genetic code of the virus. So the vaccines use the genetic code of the spike protein, which is the protein on the surface of the virus that is used to attach to human cells. So they had that ready to go as soon as they knew the genetic code, which the Chinese had published. So they were able to begin testing and begin the trials. So any vaccine goes through phase 1, phase 2, and phase 3 trials. Phase 1 is just a small number of people receive the vaccine, and they're trying to determine, of course, is it safe, but what is the right dose for that vaccine? And then in phase 2, they move on to a larger number of people, and they're trying to get an idea, does this vaccine really work? So some people will get the vaccine and some people will get a placebo or another vaccine. And then if that goes well, then in phase 3, they'll do a larger number. So for the current COVID vaccine trials, it's 30 to 65,000 people or so. And half get a placebo, half get the vaccine. And then they follow them over a period of time. Of course, they're still checking for safety, but it's really to see, does it work? And one of the, I don't know if you want to call it a benefits, but one of the advantages of the high rate of spread in the US has been, you don't have to wait very long to see if the vaccine protects people from getting it because there's so much spread, which is different from other vaccines where there's not very much disease and you have to wait a long time for people to get exposed so you could get the right number of the right statistics to do a valid analysis. And then it's submitted to the FDA after it completes the phase 3 trials. They do an analysis of the data. Now, the thing you want to keep in mind that a lot of people don't know is there is a data and safety monitoring board for all of the trials. This is a group of people who monitor the trial. They are independent from the pharmaceutical company. They are independent from the FDA, and they're looking at the data that is generated during the trial, and they're looking for safety issues. Has anyone gotten seriously ill? You know, with that many people, it's likely that someone may die during the trial, and they have to determine, was this the vaccine or was it not? And all of those things. And they monitor it, and no one sees the data but them. But then so they can pause a trial if something happens to one of the participants till they figure out, is this the vaccine or not? Or if there is a big issue, they can just stop the trial, and that's the end of that vaccine. So that's important for people to know. And then once it goes to the FDA and it's reviewed, usually what happens is that's when, if they get it gets approved, that's when the company starts scaling up their production and making large number of doses. Usually they would just make a number of doses for the trials, but then they would wait for approval to scale it up. And some of you may have gotten the shingles vaccine that came out a few years ago, and that a lot of people wanted it and couldn't get it. And it was because the company waited to scale up until after it was approved. So it took a while for them to get to that point. So with the COVID-19 vaccines, they've been able to shorten this process a couple of ways. One is the funding. The US government has provided plenty funding, and so they're able to combine phase 1 and 2 or phase 2 and 3. So because, you know, phase 2, it's a small number to see, does the vaccine work? And that's so you don't end up spending a whole lot of money for a vaccine that's not going to work in the end. But they've been able to combine phase 2 and 3 in some of these trials to get larger numbers and results faster, but they're still doing the study. And then the US government has funded the pharmaceutical companies to scale up their production now before they're ever authorized for use by the FDA, so that you get millions of doses that have already been manufactured. So if the FDA authorizes the use of the vaccine, then those doses are ready to ship as soon as the authorization by the FDA is made. And there's another group called the Advisory Committee for Immunization Practices, and they advise the CDC, but they actually are the group that makes the recommendation for who should get this vaccine based on what population it's most effective for, and what the timing of the doses should be. And so some of the vaccines right now will be they're tested at 21 days apart. You have to have 2 doses 21 days apart. Another one's 28 days apart. And so then there'll be some determination about how much longer after 21 days can you get the vaccine. That's the minimum interval. What's the maximum? So there's lots of things that have to be addressed, and the ACIP has to make the recommendation as well as the FDA authorizing the vaccine. So there's a lot of people that look at it, and then at those points, all the data will be available for people to view. And once the trial is over, because they don't want the trial to be skewed by people looking at the data, right? Because that can bias it. But afterwards, it will all be public. So those are some of the ways they've shortened it. And I think that if the vaccine becomes, I've learned enough in the last few years as medical director for the immunization program at the health department about how all this works, that I feel confident that if it makes it through the use for FDA authorization and the ACIP recommends it, that it will be safe and effective as any other new vaccine. Of course, for any new vaccine, the common side effects of a vaccine will show up in the first couple of months after a person's been vaccinated. So we'll know what the common side effects are of the current vaccines that are being developed. What we won't know are the rare side effects. So some side effects are, like 1 out of every 100,000 people, or even 1 out of 1 million. There won't be enough people in the phase 3 trials for some of those side effects to show up. So there are safety measures, monitoring measures in place. There's a vaccine adverse event reporting system. So if anybody has an adverse event, they can report it. The patient can report it, a doctor, a nurse, anybody can report to this system. And then if certain things, if they start seeing, we're seeing several of these kinds of things being reported, they go to another system that looks at health systems. So they have several, like Kaiser Permanente, that has complete data on all their patients. They can look and see, do a valid statistical analysis on them. The FDA has this huge database of probably 160 or more million people in it, and they look for insurance claims and correlations. So they should be able to identify rare side effects if that is the case. And then there's another group that does research on the side effects to see how it works and what you can do to prevent it, or how do you give warnings, a contraindication that someone who should not receive the vaccine. So all of those are already in place for all vaccines, and the COVID-19 vaccines won't be any different.
Thank you very much. We're coming to the conclusion of this session. Is there a final question someone would like to make? Then I will just close this by saying thank you.
Can
Yes,
I just say one thing?
please say one thing.
Yeah. So we talked about the reluctance, because a lot of people won't know this information. So if any of you, because the vaccines that are being made are for adults, they're not being made for children right now. They haven't been adequately tested in children. But if you, as community leaders, receive the vaccine when it comes your turn, if you would just post, "I got the vaccine," so that it becomes the normative thing for people to do, I think that would be probably one of the most helpful things you can do. One of the things you should not do is don't put hashtags from the CDC, because all the vaccinators they look for those hashtags and they will bombard you.
Good to know. And once again, the Arkansas Department of Health has a wealth of resource information that I encourage everyone to go to, link to, and share amongst your neighborhood association members. And we'll all be sharing amongst ourselves those clever things that someone's discovered that helps take a little bit of the sting out of confinement to the house. And maybe we'll find a few things this holiday season we can work on safely together to help folks who need a helping hand in some way or the other. I'm going to say now we're closing this session, and it will be posted on the LR Neighborhoods account on YouTube shortly. Thanks again for your participation. The meeting.
Thanks, everyone.
Oh.